I'm brain injury attorney Michael Kaplan. Today on the Brain Injury Insider, I want to call your attention to an important breakthrough in the management of traumatic brain injury. The development of outpatient clinical practice guidelines designed to standardize care for the millions of Americans recovering from a TBI. Although protocols exist for emergency care and hospital management of people with a brain injury, no protocols exist regarding outpatient management following emergency care or inpatient hospital care, and no guidelines exist for individuals who were never seen in a hospital. Patient care following a traumatic brain injury is often inconsistent, fragmented, and inadequate. This includes people suffering from concussions, as well as other types of brain injury. Less than half of individuals with a traumatic brain injury receive any follow-up care after they leave the emergency department. Failing to provide follow-up care contributes to prolonged symptoms, unnecessary disability, and missed opportunities for early intervention. To address this, the Action Collaborative on TBI Care, part of the National Academies of Science, has developed guidelines that focus on the first 6 months after injury. These new guidelines are published in the Annals of Family Medicine to make outpatient care predictable, effective, and patient-centered. Here's a summary of these recommendations. There is a need for standardized diagnosis and initial assessment. Clinicians are urged to use consistent diagnostic criteria and validated tools to identify TBI symptoms early in the process. This includes screening for cognitive issues, emotional changes, balance problems, headaches, sleep disturbances, and other common post-injury symptoms. Active follow-up is urged, not a let's wait and see attitude. The guidelines stress the importance of scheduled follow-up visits, especially within the first few weeks after injury. The guidelines recommend monitoring symptom progression, assessing functional limitations, and adjusting treatment plans rather than waiting for patients to report worsening problems. The guidelines recommend early, targeted symptom management. Rather than assuming symptoms will resolve on their own, the recommendations call for early treatment of headaches, dizziness, mood changes, and sleep disturbances, and offering guidance on returning to work, school, and daily activities. Recommends timely referrals to specialists. The guidelines emphasize that primary care providers should not hesitate to refer patients to neurologists, neuropsychologists, vestibular imbalance therapists, vision therapists, and mental health care providers. These recommendations are crucial when symptoms persist beyond expected recovery timelines or when more complex deficits emerge. And finally, patient education and support is vital. A major recommendation is ensuring that every patient and their family receives clear, accessible information about expected symptoms, warning signs that require immediate attention, and the typical recovery timelines. The guidelines recommend guidance on how to manage daily activities safely. These recommendations create a structured roadmap for outpatient TBI care. They emphasize early recognition of problems, coordinated follow-up, and prompt referral when symptoms don't improve. For patients and families, the message is clear. Recovery from TBI requires ongoing attention, not a wait-and-see approach. Thanks for joining me this week on the Brain Injury Insider. If you found this information useful, please consider sharing it and subscribing to future editions. I look forward to seeing you next week on a new edition of the Brain Injury Insider.